So let's start with Medicare reform. And first we should really understand what exactly Medicare is. And it's an insurance program that was started by the government in 1965, which guarantees access to health care for people who are 65 years or older, or those with disabilities or who are on dialysis. Because people with disabilities tend not to be able to have a job and pay for their health care, and dialysis is prohibitively expensive for any person to pay for on their own. So everyone pays into Medicare, and then this pool of money is used to fund everybody else's care. Well, not everyone else, but the people who qualify. Now, this differs from the way that traditional insurance manages their risks, where this person may pay less than this person because this person smokes, and these people may just be excluded altogether because they have pre-existing conditions. And so that's how they manage their risk profile, so that they could pay for the insurance of all of those people who are in their plan. And another thing that they have been accused of doing is denying claims as a way to control their costs. So all people enrolled in Medicare get the same defined benefit. If you are admitted to a hospital, then that would be covered under something called Part A. And if you're seeing your doctor in the clinic, so outpatient care, that's covered in Part B. So both of these will be paid by the government directly. Now, they don't have to do it that way. They could do it a different way. They could pay that same money to a health insurance company, and then the health insurance company pays for all this stuff. So they pay this dude, and then he pays the hospital or the outpatient doctors. Now this thing is called Medicare Advantage, or Part C. And finally, any medications that you need, those are typically covered under Part D. So that's D as in the donut hole, which we'll talk about in a bit. So in 2010, Medicare was responsible for covering 48 million Americans. And of that, the 40 mil were those that were over 65, and the 8 mil were those that were on dialysis or with disabilities. Now, Medicare doesn't cover everything. They'll pay the doctors and hospitals some, but there are some out-of-pocket costs that the patient has to pay as well. Some people have to pay a premium. It depends on how much they've worked and paid into the system before. So if they worked for 40 quarters, or really 10 years, and paid into the system, then this person and their spouse don't have to pay a premium. And this is that Federal Insurance Contribution Act piece that you see on your paycheck, or FICA. So these guys don't have to pay a premium. But if you haven't worked 10 years or 40 quarters, then you do. And that premium will be higher if you spent less years working and contributing to the system. And actually, I drew this picture wrong. This is for hospitalized patients. This is for Part A. So again, those who worked for 10 years paid into the system, no premium. Those who worked for less than 10 years, they gotta pay. And so for Part B, when you go see your doctor in the clinic or outpatient services, everybody's got to pay. And the amount that you pay the government in your premium depends on your income. The more you make, the more you pay. And in addition to premiums, members also have to pay deductibles. So for Part A, you might have a deductible of $1,200 for a hospital stay for the first 60 days, and then for the next month after that, you have to pay about $300 per day, and then for the next couple of months after that, you have to pay almost $600. For Part B, there's a $140 yearly deductible, and after that, you still have to pay about 20% of whatever Medicare is chipping in. Or the number's different in other things, like lab tests, they'll pay all of it, so you have to pay 0%. And for psychiatric care, you'd have to pay 45%. This is just crazy confusing. And if you go somewhere that doesn't take Medicare, then you have to pay an additional 15%. So some people will buy additional insurance just to cover all this other stuff, and that's called Medigap. Is your head spinning? Because mine is. So then, what's the problem here? Well, there's really two things. The cost is growing, and the cost is growing because of two main reasons. The first is that there are going to be more old people, more enrollees, and so they project that between 2010 and 2030, we're going to jump from 47 million enrollees to 79 million enrollees. And there will be less people working in relation to those that are enrolled at this time too, so fewer people kicking in dollars into the system. And the other thing is that medical care is just getting expensive. New drugs, new technologies all cost money, and that is just causing the growth of cost to be about 5.8% annually from 2010 to 2020. And so, what's going to happen is that we will be spending more than we're kicking in. And when we are not able to cover the costs, then Medicare is said to be insolvent. And right now they're predicting somewhere around 2024 is when that's going to happen, when Medicare is basically going to run out of money. Now, ever since Medicare was created, this insolvency thing has loomed in the future, and that has always been anywhere from 2 years to 28 years in the future, so about 11 years on average. Then I presume that people kicked in more money, and it causes this thing to be kicked down the road. But so right now we're looking at 2024, and as you can see, as we get out here, look at how much percent of GDP our healthcare costs are going to take. So this is how Medicare is right now. So in the next couple of videos, we'll look at what the Affordable Care Act does to Medicare, so that's Obama's plan, and we'll look at Romney and Ryan's proposal of how to fix this. Cheers.